Okay, let's talk about something that a ton of people deal with, but almost nobody wants to bring up. I'm talking about piles, or hemorrhoids. In this explainer, we're going to break it all down nice and simple with some expert guidance from the folks at Arca Anugraha Hospital. So here's what we've got on tap. We'll start with what this condition actually is. Then, we'll get into the main cause. It's all about pressure. We'll look at some triggers that are specific to men and women, then jump into simple steps to prevent them. And finally, we'll cover the really important part, when it's time to call a doctor. Let's get into it.
All right, first things first, let's just get comfortable with the topic and figure out what we're actually talking about here.
And you know, this quote is the perfect place to start. The experts guiding us make it super clear. Yeah, it can feel a little embarrassing, but it really shouldn't be. This is an incredibly common issue, and just understanding it is the best first step.
So, what are piles exactly? Well, think of them as swollen cushions of tissue and blood vessels. And here's the thing that might surprise you. Everybody has these. They're a totally normal part of our bodies. The problem only kicks in when they get swollen and inflamed.
And it turns out they come in two main flavors. You've got your internal piles, which are, you guessed it, inside the rectum. You can't see them, can't really feel them, and they're usually painless, though they might bleed. Then you've got external piles. These guys form right under the skin, and they're the ones you can usually feel, and the ones that tend to cause that noticeable pain and itching.
So you're probably wondering, why do these tissues get swollen in the first place? Well, it pretty much all boils down to one key thing: pressure. This right here, this is the main takeaway. Just about every risk factor we're about to go through all leads back to this one single problem. Way too much pressure on the veins in that specific area, which causes them to stretch out, swell up, and become a problem.
So what's creating all that pressure? Well, here are the usual suspects. Straining on the toilet from constipation is a huge one, but so is just sitting for long periods of time, like at a desk job. Carrying extra weight, lifting heavy things regularly, even chronic diarrhea can do it. And of course, as we get older, our tissues just naturally get a bit weaker, making us more likely to have issues.
Now let's dig a little deeper, because while all those things apply to everyone, there are some risk factors that are a bit different for men and for women.
And it's actually pretty interesting how the risks change. For women, pregnancy is a major trigger. You've got pressure from the uterus and just more blood flowing around. For men, the risks are often tied to occupations with heavy lifting or even intense weight training. And here's one that kind of hits everyone these days: spending too long sitting on the toilet, scrolling on our phones. That habit puts a ton of sustained pressure on the area.
Okay, so we've covered the what and the why. Now let's get to the most important part, what you can actually do about it. And the good news is, some really simple changes to your lifestyle can make a massive difference.
Think of this slide as your game plan. It all starts with what you eat and drink. More fiber, lots of water. That keeps everything moving smoothly. Regular exercise helps too. And then there are a few key habits. When you have to go, go. Don't strain. And try to keep your toilet time under 5 minutes. And of course, maintaining a healthy weight and lifting properly, it all helps reduce that core problem of pressure.
All right, finally, and this is super important. While all these prevention tips are great, it's absolutely crucial to know when it's time to stop trying to handle it at home and go see a doctor.
Here's the #1 thing to remember. Never, ever just assume. Yes, bleeding can be a symptom of piles, but it can also be a sign of other, more serious things. A professional diagnosis is the only way to know for sure what's going on.
So when should you make that call? Well, if you have any bleeding that lasts for more than a week, if you're in severe pain that isn't getting better, if you feel a lump that's growing or changing, or if your symptoms just aren't improving after a week of taking care of it at home, it's time to get it checked out. And just a quick reminder that all the info we've covered today was guided by the medical pros at Arca Anugraha Hospital, who are all about approaching treatment with compassion.
So let's end with this question to think about. When you look back at all those prevention steps, your diet, your exercise, even your bathroom habits, are the little things you do every day actually protecting your health for the long run? Because really, it's those small, daily choices that have the biggest impact of all.